Hi everyone, my name is Guillermo Saraco, and with Ryan Doherty and Rand Jacobs, I will present to you our proposal on the steps to take in order to control the problem caused by antibiotic resistance. In response to the severity of this problem, which is constantly being accentuated due to the overuse of antibiotics, we propose measures that the Centers of Disease Control and Prevention can recommend in order to effectively control this problem. We will explain the issue by giving you the essential background information on the topic and explanations of each part of the proposed solution. Later, we will finalize this presentation with a conclusion. So what is antibiotic resistance? The natural phenomenon of antibiotic resistance exists when bacteria that was previously killed by a specific antibiotic becomes immune or resistant to such antibiotic and is still able to reproduce. What are the effects of this? This makes antibiotics that have been previously used to treat infections ineffective. This causes a real threat to the public health. In fact, the World Health Organization has manifested their concern with regards to the severity of this problem, and based on data collected from 114 countries, has revealed that the consequences of antibiotic resistance are not just a prediction, but a reality that's affecting the whole world. So what's the problem? The main problem that needs to be solved is the considerable overuse of antibiotic drugs, which has been a product of their efficacy in killing bacteria, in addition to their relatively low cost and availability. Overconsumption of antibiotics has been occurring not only in hospitals, but also in homes, commercial husbandry, and agriculture. In this proposal, we outline the different approaches to limit the overprescription and overconsumption of antibiotics. To do this, we provide insight on the practices being conducted in other countries and describe the measures that need to be implemented in hospitals. The main points we will address are pharmacist-doctor consultation, which means requiring doctors to seek out counsel from pharmacists. The second point is to implement prescription reassessment in order to help doctors more easily identify if a prescription is working as intended. The third point is to increase education and awareness, which would be done in order to prevent patients to request antibiotics unnecessarily or help them use them correctly if they really need them.
The first part of our proposal is the recommendation that doctors seek counsel from pharmacists. Currently, pharmacists have a limited role when it comes to the entire prescription process. However, they have a wealth of antibiotic knowledge that can be tapped into to improve the prescription process. In the United Kingdom, hospitals have started hiring specialized antibiotic pharmacists. These pharmacists monitor the usage of antibiotics and advise the doctors on when it is appropriate to prescribe them. This greatly improves upon the prescription process and leads to more effective prescriptions. Despite the advantages, we have not seen many signs of this position outside of the United Kingdom. Many hospitals wonder why a doctor should seek counsel from other physicians. That question has many answers. Kieran Hand in the Journal of Antimicrobial Chemotherapy talked at length about the successes hospitals have enjoyed after hiring specialized pharmacists. Since hiring, these hospitals have seen reductions in patient length of stay, drug administration, and number of treatment failures. We believe that the more people that are involved in the prescription process, the better the prescription will be. Most importantly, the increased accuracy of these prescriptions will help to curb the trend of antibiotic resistance. Specialized pharmacists possess vast knowledge about antibiotics, and the CDC should encourage hospitals to hire these pharmacists. The second part of our proposal pertains to prescription reassessment. Typically, doctors write a prescription and do not see the patient again. Prescription reassessment is when a doctor writes a prescription for a patient and then checks back in within 48 hours with the patient later on to see how they are progressing. This practice has numerous benefits associated with it. It allows the doctor to check in to see if the patient's symptoms are improving. Reassessing the prescription allows the doctor to refine their idea of what they think the problem is and how to treat it. If it is discovered that a prescription is not working as intended, a reassessment appointment can save time and potential health complications that may arise from further mistreatment. We are proposing that the CDC encourage the practice of prescription reassessment in hospitals when antibiotics are administered. Prescription reassessment has been tried in a province in China called the Ningxia province. The government here intervened on local policy in an attempt to minimize the unnecessary prescription of antibiotic drugs. Through an incentive program, the government paid health centers 70% of their budget at the beginning of the year. After they received performance assessments, they would give either above or below the remaining 30%, depending on how well the health center performed. Through the government intervention in the Ningxia province, they saw a 15% reduction in antibiotic prescriptions. From this study, we can see how government intervention increased the efficacy of antibiotic prescriptions. A similar government intervention of prescription reassessment will yield similar results. A lot of doctors are worried about prescription reassessment. They believe that even after taking antibiotics, patients are still at risk to develop bacterial infections. Many doctors prescribe antibiotics as a safety measure to ensure that bacterial complications don't arise in their patients. As a result, doctors are concerned about the short 48-hour window to reassess a patient. Taking into account this information, we propose that we give doctors anywhere from 4 to 6 days to perform a patient reassessment. We believe that this range is short enough to prevent antibiotic resistance from occurring, but long enough to give doctors the peace of mind that their patients will not develop any sort of bacterial-derived complication. If the CDC supports mandated patient reassessment, then results similar to what was seen in China will occur.
The third part of our proposal is for the CDC to develop a stronger awareness campaign to increase education of doctors and their patients. Most patients don't know the risks associated with the overuse of prescriptions, and therefore request antibiotics unnecessarily, or do not follow prescription instructions appropriately. Awareness can be raised in many different ways, and we propose that the CDC look into investing more heavily in public service announcements, support the creation of legislation to change labeling practices, and urge the government to mandate more proper education of patients through their doctors. A study was conducted in Israel to measure if an intervention would reduce antibiotic use amongst children. Their approach focused on increasing public awareness of antibiotic resistance. They required doctors to better educate their patients on the antibiotic drug use. As you can see from this graph, the study shows significant improvement in antibiotic prescription rates throughout the years in which it was implemented. The years that are noted 0 and 1 were the 2 years before the government intervention was put in place. Years 2 to 4 were the years when the study actually took place, and year 5 was the analysis of the follow-up year to see if antibiotic prescription rates would stay consistent to the numbers obtained in the study, or if they would start to rise after the study was complete. A control group was also used to compare statistics with the intervention group, and as you can see from these numbers, there was a 40% decrease in antibiotic prescription rates among intervention physicians and their patients. This goes to show the success of implementing such a program, and the CDC needs to start promoting these strategies. According to an article by Consumer Reports, there are about 500,000 Americans that misinterpret their prescription labels every year. The Advertising Research Foundation stated the use of a strong public service announcement campaign can reach up to 40% of target households. And the Israel study proved that increased awareness and communication between doctors and their patients will reduce the unnecessary overprescription of antibiotics. With that, we urge the CDC to create a single campaign that encompasses all 3 of these ideas. This campaign will change labeling practices to make them more comprehensive, increase the use of PSAs to target a bigger audience, and influence the government to start putting practices in place so that doctors can and will better educate their patients about antibiotic use and the issue of antibiotic resistance. There are currently more than half of all hospitalized patients that will receive an antibiotic at some point in their stay. The United States Centers for Disease Control and Prevention should begin implementing new measures to combat the overprescription trend of antibiotics that has become commonplace in the healthcare industry. Government intervention has proven to yield positive outcomes. Taking these steps to reduce the antibiotic prescription rate will end up protecting the lives of American citizens by eliminating the significant threat of antibiotic resistance. If you have any questions, please feel free to contact us through our Husky emails. Thank you for viewing our presentation.